Well, I'm often asked, what is the period of purple crying? And it's understandable that people should ask. It's an interesting phrase. And what it captures is this remarkable behavioral activity of infants in the first few weeks and months of life. And we call it the period of purple crying because it starts at about 2 weeks, gets worse for a number of weeks, and then gets better at about 3 or 4 months of age. And that's very important for parents to know. What the word purple refers to are the 6 characteristics of this crying behavior that really can be frustrating or even anger-provoking in caregivers. And let me just state what those 6 characteristics are. So the first P refers to the fact that the amount of crying that infants do, starting at about 2 weeks of life, tends to increase every week until it reaches a peak sometime around the middle or end of the 2nd month of life. So in any one day, an infant may cry a certain amount, and the next day and the next day cry more and more and more until it reaches that peak period. And for some infants, that peak will occur at 3 weeks of age. For some, it will occur at 8 weeks of age. But for all infants, they tend to increase the amount of crying they do on a daily basis and then decrease the amount of crying over the next few weeks or months of life. The U is for the fact that some of this crying comes and goes unexpectedly. By that I mean that it's not related to dirty diapers, it's not related to feeding, it's not related to anything that's going on in the environment. The baby just starts spontaneously, cries for a long period of time, and then stops, no matter what the mother or the father or the caregiver does. The R is for the fact that some of these bouts, some of these episodes of crying are resistant to soothing, and that can be incredibly frustrating. No matter what the parents do, the crying doesn't stop, the baby continues to cry, sometimes for 20, 30, 40 minutes or even a couple of hours, and that can be very frustrating, of course, as well. The second P is for the fact that when the baby cries, it looks like it's in pain, and that's understandable because the crying that infants do, the facial expression and the sounds are the same whether or not a baby is crying in pain or it's just crying spontaneously as in the period of purple crying. The L is for the fact that some of these bouts are very long-lasting. It's the longest crying bouts that infants will ever have, usually averaging on about 35 minutes or 40 minutes per bout, and that's longer than ever occurs again. Some of them, of course, are as much as 2 to 3 hours, which is even more frustrating. And the E refers to the fact to remind parents that this tends to occur in the late afternoon and evening hours. Even though it can happen at any time of day or night, it's more likely to happen in the late afternoon and evening. And this can be frustrating because parents who have been with the baby all day are tired, parents who are coming home from work are tired, and they have the feeling that the baby's just doing this to get at them. But it's not true. They just tend to do it in the late afternoon and evening hours. And another question I'm asked is whether or not this period of purple crying is the same or different than colic. And that's a very good question because, of course, the word colic has been around for a long time. The word colic is used by pediatricians, it's used by mothers and fathers of babies to describe a very high crying infant. And for those people who have had a baby like this, they'll recognize all of the characteristics that I just described when I described the period of purple crying. But what's different about colic is that it's usually considered to be a condition or an abnormality that some babies have and that other babies don't. And that's not the case for the period of purple crying. What we are describing here is the pattern of crying and the characteristics of crying that all infants have. It's certainly true that some have much more of it and some have much less of it, but they all have this tendency to increase the amount of crying they do in the first couple of months and then decrease it afterwards. They all have the tendency to have unexpected crying, to have crying that is resistant to soothing, that has a pain-like face and long episodes and clusters in the evening. And while that is also true of infants who have traditionally been called colicky, it's true of all infants, and that's why it's important for all parents and all caregivers to know about it. So that also brings up another important question, which is, how do you know that your baby's not sick if it has these characteristics of crying? And that's an important question as well, because any baby who is sick certainly is likely to cry more. But of course, what we're talking about here is a pattern of crying that goes over days, weeks, and months in the first months of life of a baby. If a baby is sick and cries, that's likely to be more acute. It's likely to be associated with some other things like diarrhea and vomiting, or a fever, or weight loss, or not feeding, and other kinds of behaviors like that. But because it may be due to a disease, it's very important that early on in the crying that your infant does, that you do see your physician or your healthcare provider so that he or she can do a number of tests to make sure that this crying is not due to some other disease or some other condition. And the vast majority of time, over 98% of the time, it won't be. But it is important to have your baby checked by your healthcare provider. When that's done and when they do their tests, and if the crying continues to go on, it will not be a surprise, because this, as we said before, this period of purple crying is something that all infants do. They do it more or less. It's part of normal behavioral development, even though it's incredibly frustrating to parents and caregivers. The other thing that's very helpful to know about the period of purple crying, and this is the reason we use the word period, is that the long-term outcome is actually very, very good for infants that go through this period of purple crying. There is no increased risk of negative outcomes later on, of having a disease later on, of having allergies later on, or anything like that. The period of purple crying is part of normal behavioral development, and the word period attempts to capture that. It starts at about 2 weeks of age. As we said, it peaks at the 2nd month of age, or sometimes into the 3rd month of age, and then it tends to decrease by the 3rd or 4th month of age. And therefore it's something that does come to an end, however frustrating it may be when it's happening with the caregivers or with the parents of the infant. The one negative consequence that can come from this crying, however, is if the caregiver, whether that's the parent, a temporary caregiver, or an in-law, gets so frustrated and so angry that they lose control and do something negative with the baby. The one we talk about most often is shaking the baby. This is what's called shaken baby syndrome. And if parents take the baby and when the baby's crying and they hold it in front of them and they shake the infant back and forth, and the infant can suffer what we call shaken baby syndrome. And this is a very, very severe form of abuse. It's very dangerous for the baby. The baby can have significant brain damage, it can have blindness, and it can have cerebral palsy and all kinds of other negative consequences that are not good for the infant. And this can be prevented by just understanding that this early infant crying pattern is not something that's directed against the parent. It's not because the baby's a bad baby. It's not because the caregivers are doing something wrong. It's because it's a normal part of infant development. It's very frustrating, of course, if you're the only one with the infant and taking care of the infant, but it is important not to lose control, not to be frustrated by it, and not to get angry, and never, of course, shake the infant. Much better to put the infant down in a quiet place, walk away, gain control of yourself, and then come back and check on the infant in 5 or 10 minutes after you feel better. It's also important for parents who are going to leave their baby with a temporary caregiver that that temporary caregiver understand the period of purple crying too, because that inconsolable crying bout may come when that temporary caregiver is there, and they need to know not to shake the infant, that it's okay, that it's not their fault, that they can call you and let you know that the baby's crying so that you can come back home and help them with it, but not to lose their temper and not to lose their control.